Morning. I'm Dr. Vineet Malhotra. I'm the urologist and andrologist at VNA Hospital, New Delhi. And I've been using these Zephyr products, implants, now for more than 6 to 7 years. I think I did my first implant with them about 7 years back. I've been very impressed with the products, and that's the reason that I've used the products. And the fact that it's a urologist that's developed these products makes even more sense because they understand the need of the patient. So, if you look at the semi rigid device, the malleable device, the core is limited, which means that if I have to have a length which is shorter for the penis, I can still fit the core into the malleable region, the hinge region, and get enough concealability. That's something lacking with most other devices that have a core. So if you look at the other malleable devices, they have a much longer core, which doesn't give them that advantage because you can't cut through it. Here you can cut through both the proximal and distal ends, and that gives you the advantage of actually putting it in the appropriate location, getting maximal concealability. So I think this device scores over the other malleable devices significantly in that regard, that the core is shorter and allows this kind of trimming of the malleable device. So useful malleable device, inexpensive, good to use for patients. The other thing that I've used is their inflatable device, and the most impressive thing about their inflatable Zephyr device is the box itself. So if you look at the box, they have a furlow which is included into the packaging, which means that so I have, for every implant that I do, I get an additional furlow, which I then use as a sizer and also use for the placement of the cylinders itself. They have all three sizes within, which means you don't have to have so much inventory. If the length is different, if the size is going to be different, you within the same box you have different sizes available. So you're able to utilize that. uh, Overall, a fairly reliable device. In fact, I have a patient that I had operated about 7 years back with an inflatable, who had unconsummated marriage. Recently he's followed up with me, doing well with his implant, has two kids now. Wife is very happy. They didn't have any kids before. They've consummated. So, you get these happy stories from inflatable devices in any case, but they have a very good overall box that gives you all the things that you need within the implant itself. Finally, the sphincters. I've done a few sphincters, though. With the sphincters, one of the things that I'll tell you is that it's a thinking man's sphincters. You can't do these sphincters without being aware of the fact that you need to balance the device very well for uh, the cuff to work. But if you understand the mechanism, then it's a very useful device. I've had several young men that have required this for total urinary incontinence, doing very well because of the fact that once I understood how I had to, so it takes some understanding, no doubt about that. But once you understand how the balancing works, then you're able to actually place the sphincter and make it work really well. Again, it doesn't have too much of a memory. This is a two-piece component. It doesn't require a third component within it itself, which is why it's a simpler device to place. It's in fact one of the simplest devices to place. You hardly require any skill to be putting in a sphincter, because you have just these two components that control the entire sphincter. You put this cuff, this goes into the scrotum placed anteriorly, where you can then use the deflate pump very easily on a superficial location. And otherwise, a simple device to place, simple device to use, requires some initial understanding of how you have to exactly balance the pump so that this gets working well. So Zephyr implants, in the overall scenario, very good, very reasonable, priced well, and I would suggest if you're looking at malleables, inflatables, or the sphincters, this is something to look at. Thanks.